Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Wednesday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, December 15th. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading discussion today is myself, Sophie Bukowski, a research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Thank you, Sophie.
In the United States, yesterday, we saw over 50,000 positive new cases, with hospitalizations increasing and the death rate increasing by enormous amounts. This is, as predicted by many of them. And in Illinois, yesterday, we saw over 3,000 positive new cases, with the 7-day average also peaking over 3,000. Hospitalizations are increasing and the death rate is also increasing in Illinois. So, Dr. Murphy, what can we do with the numbers that we are currently seeing, all over the United States?
Well, it was predicted that we're going to have this winter wave. What was not predicted was that this was going to be basically a triple whammy. It's going to be RSV, it's going to be flu, it's going to be COVID, and the three of them are barreling in together. The reason for this, there's a couple reasons for this. One is that we have kind of an immunity gap. In other words, everybody was so careful for a couple of years. The population didn't get exposed to enough viruses and bacteria to keep the herd immunity up. I mean, that's a theory. We don't know if that's really true. Second is that the viruses can be changing. RSV can be changing. Flu is changing. This is a worse flu than usual, by the way. And COVID is changing, constantly changing. So, all those factors really come into play. The other thing that's happening now is that we're testing like mad because of all the investment that was made in diagnosing COVID and then what other respiratory infection was happening. These rapid tests have really changed the game. I mean, you can test for all these things rapidly now. Now, RSV is not as far advanced, but it's all going to be possible that you go in, get a little card that's got a bunch of things on it, put your specimen in there, and you're going to find out whether you have flu, RSV, strep, or whatever, whatever they put on the card. So, and then there's a treatment for each one of those except for RSV, but that's going to change too. RSV is going to have a treatment in the not too distant future. It's a totally treatable virus. So they just have to focus on it now. And another reason why these rates are going up is that there's so much testing that we're just testing like mad. So all those things are why what's going on, but this is completely predicted. The thing that we didn't predict was that it was going to be this triple infection thing. It usually doesn't happen like this. It usually one takes over. Like during COVID, there was like no flu, none, just like didn't even happen, hardly. Anyway, so as far as the numbers you said go, the numbers are going up. Now, remember, the only reportable numbers are those done in a certified laboratory. Most of them are PCR tests or some kind of molecular test. And there's a huge number of unreported cases. So this number is just a sentinel number. It could be 5 or 10 times higher. We don't know, because the home rapid tests, where like most of the patients that are calling me saying they're positive, should I take Paxlovid or whatever I should take, those aren't even reported. I haven't, other than one patient, I don't have really that many patients, but only one patient had actually had their test done in a laboratory that reported it. All the other ones didn't. So that's part of the problem. But anyway, but the cases are going up. The number we can debate. The hospitalizations we know a little bit better. We know a lot better, actually, because we know who goes in the hospital. We know every state now tracks hospital capacity, and hospitalizations are going up. Pediatric, way up. All right, they're much more susceptible to RSV and flu. And what's good so far is that the death rate has continued to decrease, still in this like 300 range per day. I mean, that's terrible, but it's not going up. Now, remember, A person gets infected, they get sick, they go to the hospital. It's all in this timeline. They end up in the ICU.
Mhm.
Some people die. And so that takes a while. So the death rate is always the last one to move. So we'll see. But right now, people are at least optimistic that we're not going to have this huge peak in deaths like we did at the beginning of the pandemic. So we'll see if the immunity that the country has is holding us together. And a few people are going to get sick. Most people are older, which is very typical with pneumonia. That's the people who suffer the most. Over 90% or over 65. And, if you have underlying diseases, of course, you're at higher risk for complications. But we'll see how this pans out. But remember, we're only in the middle of December. This usually starts in the middle of December, and we're already kind of there. So that's the next 6 to 10 weeks is going to tell the story.
Yeah, no, absolutely. So going into our first COVID headline, the first one is that COVID tests are being recalled over false negatives. So what can you tell us about what people should look out for with COVID tests, like home COVID tests?
Yeah, the home tests in particular have this problem. They're not 100%. They're not even close to 100%. They're in the 90s or 80s. The lowest is 80% detecting all the cases. They also detect the cases later than PCR. So, and that test also becomes negative first, and it's associated with fewer infections if you're transmitted infections if you're negative versus if you're positive. But anyhow, the tests are a little bit fickle sometimes, and you have to keep watching them because do they work against the current variants and whatever. And a company called Detect Inc. Their test was found to have too many false negatives. In other words, you took the test, it was negative, but you actually had COVID. And like I said, there's a percentage that you have to accept with those tests. And that's why doing multiple testing is good. But this really fell out of the acceptable range. And so those tests from Detect Inc., they have expiration date of January 1st, 2023. So they're almost all expired anyway. But if you had used one of those tests are not considered reliable if they're negative. If they were positive, it's a positive test. But if they were negative, it didn't really, unfortunately, tell you anything.
Yeah, that's really unfortunate.
Yeah.
And now going into our second headline, long COVID has played a role in more than 3,000 deaths in the US, the CDC is now saying.
So people are looking more seriously now at long COVID, and the report from the CDC has identified at least 3,500 deaths from long COVID, not regular acute COVID, but long COVID. It's a difficult study to do because there's actually no diagnosis code for long COVID. So there's ways around that, looking at other diagnostic codes and also concomitant with COVID or recent COVID in the last months or so. And they have concluded that long COVID contributed to at least 3,500 deaths in the United States. This was just published yesterday. It's the first such study actually published worldwide about deaths in long COVID. And it came from here, from our CDC. And so it shows that, we need to really continue to look at long COVID seriously. So they looked at who were these people that were dying? And you follow many diseases, it's, oftentimes, underprivileged minorities, they don't have access to as many medical facilities or treatments or whatever. There's always this kind of the same knee-jerk reaction. With this, it's actually not that at all. And it's white, male, older. And you can put 2 and 2 together and figure out why that's happening. But those are the ones highest at risk. Of course, this can happen to anybody, and there's all people from all walks of life that have succumbed from long COVID, but those are the ones that statistically stand out. So again, highlights the need for better prevention of getting COVID in the first place, getting serious COVID in the first place. And that's by vaccination. And if you get infected, treatment with right now, there's only one treatment, Paxlovid, but there'll be others in the not too distant future. So that's long COVID.
Yeah. And then going into our third headline, which really ties closely into what you were just talking about, COVID-19 vaccines have saved more than 3 million lives in the US, studies now showing. But that doesn't mean it's not over. And there's so many people who aren't vaccinated. So can you tell us a little bit about this?
Well, yeah, this is a beautiful study that comes out of Yale School of Public Health. And these are PhD epidemiologists who track all sorts of diseases, causes of death, and so forth. So they came to their conclusions were that comparing vaccinated to unvaccinated people, and this is not difficult to do, that COVID-19 vaccines have kept more than 18.5 million people in the United States out of the hospital. It also saved, like you mentioned, 3.2 million lives in the study that they report. You dig down into this data and you find that if the vaccines had taken multiple years, we're right at the 2-year anniversary of the first vaccine being given right now. So it's a historical month in vaccines. But if those vaccines had taken 3 years or 4 years to get approval, and we'd be getting them right now, 1.5 times as many more people would have been infected. 3.8 times as many people would have been hospitalized, and 4.1 times more people would have died. So 1.1 million people died. So if the vaccines hadn't been there, it would have been 4 or 5 million people had died. Now remember, only 2.8 million people die per year in the United States from everything. And so, COVID is now the number 3 cause of death. Without the vaccines, it would have been far number 1. It's really, really a dramatic finding. Not surprising, but still drama. And if you look at the medical costs of those illnesses, hospitalizations, and death, in medical costs alone, the government saved, or the country saved, $1.15 trillion just in medical costs. This is huge because there's other costs too. Imagine when you get sick, you don't work, you don't make money, you're not productive, you have all this other stress and money problems, days, life, quality life loss, all that other kind of things that you can measure. But just focusing on the medical costs, which are the easiest ones to actually get because it's all different kinds of people getting it, $1.15 trillion. Now, that basically pays for the entire public health efforts in the country for COVID, or for the hard costs anyway. So, it's just another example of public health actually pays for itself. You keep people healthy, that actually it's an investment overall in the economy and the people. It has nothing to do with politics. Mm-hmm. You invest in keeping people healthy, they're not going to be in the hospital and they're not going to die. So it's a well done study.
Yeah, absolutely. And now going into a COVID question is, and the only one is, how do I know if I have COVID, flu, or RSV?
Well, the symptoms
I'm going to share a graphic, Dr. Murphy.
You're going to share the slide with us. Okay. So here are the typical diseases and the symptoms. So just the regular cold that we don't, we know what it is, but we don't know specifically what it is in people, a cold. Then there's influenza or flu, there's COVID, and there's RSV. So if you look at those and you look at all the symptoms, cough, difficulty breathing, fatigue, fever, headaches, muscle pain, body aches, loss of smell, that's the only one that really sticks out the most. Runny, stuffy nose, sneezing, sore throat, vomiting, diarrhea, wheezing. Basically, there's little dots in every box here. So you can't, from the symptoms alone, you can't tell. You really have to test. And, tests are available for COVID, for flu, and in some cases RSV. And the cold ones, they're coming along, but there's going to be pretty soon what they call a multiplex assay, as I mentioned earlier, that shows that that you can put your specimen in like a card, and all those things will be tested at the same time, and you'll find out what you have, and then you can direct your therapy in one way or the other. So unfortunately, the symptoms don't help too much. You have to get some kind of test.
Yeah, no, absolutely. Well, Dr. Murphy, those were all of our COVID questions for today. And we will see you next week.
All right, see you next week.